Well, active surveillance has advantages for the patient, of course. There are very few side effects.
Active surveillance is appropriate for men with a Gleason score of 6 or below and a PSA level below 10. They must also have less than 50% of the biopsy course showing cancerous cells.
The downside is that there is the risk that the cancer could develop during the time when no treatment is being offered. On the other hand, with careful surveillance, monitoring with scans and with PSA testing and repeat biopsy, that risk is relatively small in patients who have low-risk cancer in the first place.
A man who opts for active surveillance needs to understand this is not supervised neglect. This involves regular monitoring, usually in a hospital environment with blood tests, sometimes repeat biopsies of the prostate, sometimes body scans, and this means that treatment can be delayed, but treatment will be offered at just the right time.
We've lived with prostate cancer for 10 odd years. In practical terms, apart from having the label prostate cancer, it hasn't affected our lives at all. Life carries on as normal.
Can hardly believe you got it half the time.
When Ivan took the decision to have active surveillance, he was symptom-free. Ivan and his partner wanted to avoid the side effects and potential complications that come with having treatment.
We had a choice from 3 options. That was monitoring, radiotherapy, or an operation to remove the prostate gland. And we chose monitoring, didn't we?
The PSA reading seemed to be quite low. Also, the number of biopsies which showed up positively seemed quite small, and therefore I thought the odds were in my favour, and therefore decided it would be better to be monitored rather than have an operation only to discover there were certain side effects which were unpleasant.
Because with the monitoring you had the choice to change your mind later anyway, didn't you?
Yeah, that's correct.
Active surveillance, also known as active monitoring, recently revealed a spike in Ivan's PSA. Now he's being checked more frequently to keep track of his health.
Because it had gone over 10 for the PSA reading, the specialist decided that they would do a full body scan, which in fact proved negative as far as I was concerned, which meant there were no problems associated with the prostate cancer having spread elsewhere.
And that was the spike, I think, wasn't it?
Yes, that was it.
Which is interesting. That was a PSA at a level that, you know, for many patients might have led them to go down the route of having something more active done in terms of surgery or radiotherapy.
When Ivan was diagnosed with prostate cancer, he had a Gleason score of 6, and many men in that situation would have chosen to have active treatment in the form of radiotherapy or surgery. But by choosing active surveillance, Ivan has had 10 years now of relatively symptom-free time and has avoided all the potential side effects of more radical treatment.
I mean, after your recent spike, you've been on the 3-monthly surveillance, haven't you? I mean, do you feel happy now that the PSA has been shown to stabilise? Do you feel happy staying on that 3-monthly surveillance?
Well, I'm perfectly happy being monitored.
Yeah.
Because it doesn't seem to affect my life at all.
Good.
In practical terms, you know, it's something I have, prostate cancer, but in terms of everyday living,
yes,
life carries on as if I haven't got it.
Yeah. Okay, well, shall we meet up again in 3 months' time?
Okay.
The sort of man who might consider active surveillance is a man with a less aggressive form of prostate cancer, known to be contained, localised within the prostate, who's looking to avoid the potential side effects of more radical treatment. So, for instance, a man for whom sexual function is still important might want to avoid the possible impotence side effect of radiotherapy or surgery. It's also important that that is a man who is happy to live with their prostate cancer, knowing that it's present and knowing that it's being watched, but comfortable with the idea that it's not being actively treated.
Life has just carried on as though it's just a label that I've got, which doesn't affect me. And I do the same things now that I did 10 years ago, just allowing for the fact I'm a bit older.